Auzubillahiminash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. Assalamu alaikum class. Today the topic we are going to discuss is femoral triangle. As we have discussed it, the femoral triangle is a triangle that is present on the front of the upper one third of the thigh, immediately below the inguinal ligament. The inguinal ligament is a reference point, as it is shown in this diagram, that it is the point that differentiates or that demarcates between, it's a demarcation point between the abdomen and the lower limb. After this point, after this structure, the lower limb starts. So the depression, that is the femoral triangle, it is present in the upper one third of the thigh on the medial aspect. It has got some particular boundaries. It is as triangular in shape. It has got an apex and a base and a medial and a lateral wall. The lateral wall is formed by the medial border of the sartorius muscle, and the medial wall is formed by the lateral border of the adductor longus. It has got a roof, it has got a floor. The apex is where the two muscles meet, that is the sartorius and the adductor longus, whereas the base is formed by the inguinal ligament. Then comes the floor. The floor of the femoral triangle is formed by the adductor longus and pectineus muscle medially, and psoas major and iliacus laterally, while the roof has got some contents along with the skin, superficial fascia. The superficial fascia contains the superficial inguinal lymph nodes, some nerves, and then comes the deep fascia. So this is the important what you can say structures that are present in the femoral triangle. Now comes the contents of the femoral triangle. The contents of the femoral triangle are: number one, femoral artery and its branches. The artery traverses the triangle from its base at the mid-inguinal point to the apex. Then comes the femoral vein and its tributaries. The femoral vein accompanies the femoral artery. The vein is medial to the artery at the base of the triangle, but posteromedial to the artery at the apex. The femoral vein receives the great saphenous vein, circumflex veins, and veins corresponding to the branches of the femoral artery. Then comes the femoral sheath. The femoral sheath, it encloses the upper 4 centimeters of the femoral vessels. And then comes the nerves. The important nerves that are present in the femoral triangle are, the most important is the femoral nerve itself, but it lies outside the femoral sheath. Then comes the nerve to pectineus, the femoral branch of the genitofemoral nerve, and the lateral cutaneous nerve of thigh. All these are the nerves that are present in the femoral triangle, along with the deep inguinal lymph nodes, and these inguinal lymph nodes, they are present deep to the fascia. The femoral sheath, it is an important structure that is present within the femoral triangle. We will see what is a femoral sheath. As you can see in the diagram, that the sheath, it comprises of two components. One component comes from the anterior aspect of the abdominal wall, and the other comes from the posterior abdominal wall. Actually, these are the two fascias that are covering two important muscles. One is the muscle that is present in the anterior abdominal wall, and that is the transverse abdominis muscle, and the muscle that is present in the posteriorly is the iliacus iliopsoas muscle. So the fascia that is covering the transversus abdominis is the fascia transversalis, that comes from the anterior aspect of the abdomen, and the fascia that comes from the posterior aspect is the fascia iliaca. These two fascias, they come from the abdomen, from the abdominal wall, and they travel behind the inguinal ligament, and they enter into the femoral triangle. The important thing regarding this fascia is that the two components that are coming from the abdomen, They travel behind the inguinal ligament to come into the lower limb, and that space from which they enter into the inguinal, they enter into the femoral triangle is the retroinguinal space. Particularly, there are two compartments that are present behind the inguinal ligament in the retroinguinal space. One is known as the muscular compartment, and the other is known as the vascular compartment. So the femoral sheath travels through the vascular compartment and enters into the femoral triangle. So the contents that are present in the femoral sheath is the femoral artery, then comes the femoral vein, and then comes the medialmost compartment contains a lymph node that is known as the lymph node of Crockett or Rosenmüller lymph node. The femoral sheath, it is itself, it is divided into three compartments. The lateralmost compartment contains the femoral artery along with the femoral branch of the genitofemoral nerve. The middle compartment has the femoral vein, and the medialmost compartment has got a lymph node along with some connective tissue. This femoral sheath, it is around about 3 to 4 centimeter in length. It covers the vessels, these particular vessels, the ones I have mentioned. The sheath covers these vessels till 3 to 4 centimeter, and then it merges with the vessels, and it ends by merging along the vessels. Um, we will discuss femoral canal now. As we have discussed before, the femoral sheath. Femoral sheath has got three compartments. One is the lateral compartment, then comes the middle compartment, and then comes the medialmost compartment. The medialmost compartment of the femoral sheath is known as the femoral canal. Femoral canal is it's conical in shape, and it has got you can say it's like a shape. It's in the shape of a cone. It has got a broadened upper end and a narrow lower end. It is bounded anteriorly by some structures, and it has got some boundaries, and it is bounded anteriorly by the anterosuperiorly by the inguinal ligament. It is bounded medially by the lacunar ligament, and laterally it has got a septum which contains the femoral vein. The entrance of the femoral canal is the femoral ring, and the most important, what you can say, the most important anatomy, or the most important clinical regarding this femoral canal is related to the femoral ring, and that is known as the femoral hernia. The upper part of the femoral canal is known as the femoral ring. The femoral ring is bounded anteriorly by the inguinal ligament, posteriorly by the pectineal ligament, and laterally there is a septum, as we can say the septum that is the septum of the middle compartment, and medially it is bounded by the lacunar ligament. Medially, the structure that is a reference point for different structures, that is the pubic symphysis. That is a reference point we use along with the femoral ring. The structures that are important related to, or they are around this ring, they are the one is the spermatic cord, in that is in males, and the round ligament of the uterus in females, and these lie immediately above the anterior margin of the ring. The second is the inferior epigastric vessels. They are close to its upper and lateral angle. The most important clinically related to femoral ring and femoral canal is the femoral hernia. femoral hernia is the herniation of the abdominal contents into the upper part of the lower limb through a weak point, and that weak point is the femoral canal. It is an important clinical what you can say entity. We discuss and we discuss it again and again that what are the potentials and what are the weak potential points through which the abdominal contents can come into the lower limb. So the femoral canal is one of the weak or potentially weak structures through which the abdominal contents can come into the lower limb. So this is known as the femoral hernia, and femoral hernia is more common in females. It is common due to two reasons, two main things, two main aspects. Where we can say one is the pathological aspect, and other is the anatomical aspect. The anatomical aspect is that in females, these are they have got like smaller vessels. Due to these smaller vessels and wider pelvis, it is common. It is common. It is not common in males. It is common in females due to this anatomy. And the other is the pathological factors. The pathological factors are those factors due to which the intra-abdominal pressure increases, and due to that increased intra-abdominal pressure, the potentially weak femoral canal becomes more wider to take in the abdominal contents. And these factors are: number one is chronic cough. It could be chronic constipation due to childbearing, and if a woman has many children due to repetitive pregnancies, these could be the factors. These are all the factors that contribute in this femoral hernia. The femoral hernia, it is basically the protrusion of the abdominal contents into the femoral canal, and they come through the femoral ring. So they come, and along with the sac, the content that is present in the sac is the bowel or the intestines. And the most important what you can say surgically, it is important if the sac gets strangulated, because it has got a neck. If it gets strangulated, then we have to do emergency operation to deal with the thing. And the process through which we deal with femoral hernias is that we reverse the whole contents into the abdomen by excising the lacunar ligament, and we put back the contents into the abdomen, and then we restitch the lacunar ligament. So femoral hernia, it is an important clinical entity, and it is an important clinical what you can say scenario that is related to the femoral canal and the femoral ring.